caused by COVID-19. I want to take this moment to thank the 4,500 of you that have already stepped up and contributed to the PHL COVID-19 Fund. The fund remains the fastest way to get help to our neighbors who are suffering the most in this time of crisis. If you are in a position to do so, please consider giving what you can at phlcovid-19fund.org. That's PHL COVID-19-fund.org. Two Philadelphians who are modeling this generosity in an enormous way are Francie Middleton and Michael Fields. They chose to contribute $250,000 to the PHL COVID-19 Fund this Giving Tuesday. Francie and Mike, thank you for your support during these uncertain times. So let's hear from them why making this donation was so important to them.
We want to say thank you to all the people and organizations who are doing so much to help our city in this time of crisis.
Giving to the COVID Fund is our way of helping the people of Philadelphia. The fund is the fastest way we've found to get help to our most vulnerable neighbors who are suffering the most in this time of crisis.
Thank you so much for doing your part. And if you haven't already, please consider joining us and making a gift. We're so honored to be in this together with you.
One of the many impacts of COVID-19 has been on our afternoon and weekend programming known as out of school time, or OST. Just as the school district itself has worked hard to get online education up and running, so has OST. So I'm very happy to announce that starting this week, many of our city-funded OST programs are offering online programs. 128 after-school programs are now offering students online lessons, academic support, and fun activities to keep them engaged. Activities include STEM and STEAM, movement and athletics, music, arts and crafts, and much more. To see all the offerings, residents can visit ost.phila.gov. That's ost.phila.gov for more information. We recognize that connection between OST providers and their students is even more important now, given the loss of instructional time. And we'll continue to support student success by ensuring children are engaged in school and focus on our OST goals of early literacy, high school readiness, and career readiness. So thanks to everyone involved in this effort to get virtual afternoon and weekend programming into the homes of thousands of students. Now, speaking of going online, another great effort is underway to bring the city's summer jobs program online. Our Office of Children and Families, the Philadelphia Youth Network, Philadelphia Works, and Work Ready partner organizations have joined together to create a virtual summer jobs initiative in the midst of the pandemic. They will be using both digital and virtual experiences to build skills and prepare young people for success in the workplaces of the future. This is great news, particularly since other cities are announcing the cancellation of their city's summer jobs programs due to the COVID-19 pandemic. Our Philadelphia partners are committed to ensuring young people are safe, healthy, and able to engage in paid workforce experiences. While Work Ready may look different this year, we are 100% committed to providing young people with paid workforce experience. You can find out more information at workready.org. That's workready.org. Finally, I'm excited to announce a new effort to remind folks to keep their distance. Folks at Mural Arts Philadelphia and the Health Department have been developing decals to be placed on the ground at businesses, public spaces, and food distribution sites around the city to help remind people to stay at least 6 feet apart while wearing your mask. The beautiful artwork on the decals was designed by local artists. This project will be scaled up to other sites in the future with support from the Partnership for Healthy Cities. The partnership's COVID-19 response is part of the $40 million Bloomberg Philanthropies COVID-19 Global Response Initiative. Now it's time to turn it over to Dr. Farley for his daily update.
Thanks very much, Mayor. The situation with the epidemic today is very similar to where we were yesterday, where we're seeing plenty of cases, but clearly we're on the downslope of the epidemic. Since yesterday, we've had 370 new confirmed cases of the coronavirus infection, bringing us to a total of 16,410. So again, you can see that trend in daily cases. It's still in the downward direction. If you want to get a sense overall how it's going, look at the website and our graph. So we do see fluctuations day to day, but the overall trend is where we want it to go. We're continuing to see clusters in congregate settings, but overall, our number of cases in congregate settings also appears to be on the decline. Our jail cluster is at the lowest point that we've been on for a while. We currently have 29 active cases in the jail. That's no new positives since yesterday, and 6 others who've recovered have been removed from isolation. And just note, if you're following these numbers, yesterday we had an error in the total case count for people who were active cases yesterday. We said it was 41, but in fact it was 35. We hadn't updated that number from the day before. I can report today we had 17 new confirmed deaths from the coronavirus infection, bringing this to a total of 743. Of those, 392 or 53% are nursing home residents. Our hospitals are pretty similar to where they were before. Currently, there are 961 patients with coronavirus infection in Philadelphia hospitals, and 1,809 in hospitals in the Southeast Pennsylvania region. 27% of our general hospital beds and 26% of our intensive care unit beds are available. All those numbers are virtually unchanged from where we were yesterday. Let me talk about testing a little bit. We have expanded in the last week or two, if you've been paying attention to these, we've expanded the number of test sites. So I won't go through any individual one, but if you look at our website, I have a long list of different sites where people can be tested. All of those sites are asking that we communicate to people, that people call for an appointment in advance. They don't want people queuing up at these sites for testing. They want to be able to be prepared to test people when they come in so that everyone is protected. So every site has a phone number. People can call in advance and make an appointment. It's easier for you and it's easier for the site. Yesterday, we expanded our criteria for who we are offering testing to or who we are recommending other sites offer testing to. Just to remind people what those are, recommending that they offer testing to anyone with symptoms that are compatible with the COVID infection at any age, but that we have priority for people in certain categories who have symptoms. That includes people with chronic medical conditions, residents and staff at congregate settings like shelters, public safety officers like police and fire and EMS, other essential workers like people who work in grocery stores or pharmacies, and people who are in contacts to known cases of coronavirus infection. All of that list, though, is for people who have symptoms. Just note again, we are not recommending testing people who don't have symptoms. And then just in general, we all want to reopen Philadelphia as soon as possible. And the way to do that is to make sure that these numbers that I'm reporting every day go down as fast as possible. The way to do that is to make sure that you're not spreading the infection to other people. So more and more people are going outside. You are going inside. Wear a mask like this. If you do that, then you're not spreading the infection to other people. My mask protects you. Your mask protects me. For more information, phila.gov/COVID or COVID-19 or COVID-19 all gets you to the same website. The phone number for medical questions, 800-722-7112. Thanks.
Thank you so much, Dr. Farley. Now we are going to go to Armando, who will read the Spanish translation of both the mayor and Dr. Farley's remarks.
Mensaje del alcalde Jim Kenney para el martes 5 de mayo del 2020. Buenas tardes a todos. Como muchos de ustedes saben, hoy es Giving Tuesday Now, un nuevo día mundial de donaciones creado como respuesta a la emergencia creada por el COVID-19. Quiero aprovechar este momento para agradecer a las 4.500 personas que han contribuido al fondo PHL COVID-19. El fondo sigue siendo la forma más rápida de obtener ayuda para nuestros vecinos que más sufren en este momento de crisis. Si usted está en condiciones de hacerlo, considere dar lo que pueda en phillycovid19fund.org. Hay 2 ciudadanos de Filadelfia que están dando una muestra inmensa de generosidad, que son Francie Middleton y Michael Fields. Ellos eligieron contribuir $250,000 al fondo PHL COVID-19 este Giving Tuesday. Francie y Mike, gracias por su apoyo durante estos tiempos inciertos. Nuestro programa de actividades estudiantiles después de clases y para los fines de semana, conocida como el tiempo fuera de la escuela o Out of School Time o la OST, también ha sido impactado por el COVID-19. Y así como el distrito escolar ha trabajado mucho para implementar la educación en línea, también lo ha hecho la OST. Así que me complace anunciar que a partir de esta semana, muchos de nuestros programas de OST financiados por la ciudad se estarán ofreciendo en línea. Hay 128 programas extracurriculares en línea que ahora les ofrecen a los estudiantes lecciones, apoyo académico y actividades divertidas para mantenerlos aprendiendo durante estas difíciles circunstancias. Las actividades incluyen STEM y STEAM, movimiento y atletismo, música, artes, manualidades y mucho más. Para ver la oferta de programas educativos disponibles, los residentes pueden visitar ostfila.gov, es decir, ost.phila.gov. Reconocemos que la conexión entre los proveedores de la OST y sus estudiantes es aún más importante ahora, dada la suspensión temporal de las actividades escolares. Así que vamos a continuar apoyando el éxito de los estudiantes, garantizando que los niños puedan participar en la escuela y se centren en nuestros objetivos OST de alfabetización temprana, preparación para la escuela secundaria y preparación para sus carreras universitarias. Gracias a todos los involucrados en este esfuerzo para conseguir una programación virtual tras la escuela y durante los fines de semana para llegar a los hogares de miles de estudiantes en Filadelfia. Hablando de servicios virtuales, otro gran esfuerzo que está en marcha es para poner en línea el programa de empleos de verano de la ciudad. Nuestra Oficina para Niños y Familias, la Red de Jóvenes de Filadelfia y las organizaciones asociadas de Philadelphia Works y Work Ready se han unido para crear un proyecto virtual de empleos de verano en medio de esta pandemia, utilizando experiencias digitales y virtuales para desarrollar habilidades y preparar a los jóvenes para que triunfen en el mercado laboral. Esta es una gran noticia, particularmente porque otras municipalidades están anunciando la cancelación de sus programas de trabajo de verano debido a la pandemia del COVID-19. En Filadelfia, nuestros aliados se comprometen a garantizar que los jóvenes estén seguros, sanos y que puedan adquirir experiencia laboral remunerada. Si bien la experiencia de Work Ready puede ser diferente este año, estamos comprometidos al 100% en brindarles a los jóvenes oportunidades de trabajo pagadas. Puede encontrar más información en workready.org. Finalmente, me emociona anunciar un nuevo esfuerzo para que la gente recuerde que debe de mantener la distancia social. El equipo de Mural Arts Philadelphia y el Departamento de Salud han estado creando calcomanías para colocarse en el piso de los comercios, espacios públicos y centros de distribución de alimentos en la ciudad para recordarle a las personas que se mantengan al menos a 6 pies de distancia mientras usan las máscaras. Las calcomanías fueron diseñadas por artistas locales. Este proyecto se ampliará a otros sitios en el futuro con el apoyo de la Asociación para Ciudades Saludables o el Partnership for Healthy Cities. La respuesta al COVID-19 de la asociación es parte de la iniciativa de respuesta global COVID-19 Bloomberg Philanthropies de $40 millones. Gracias por su apoyo. Y ahora, la actualización en materia de salud al martes 25 de mayo del 2020. Los números van mejorando. Desde ayer se han confirmado 370 nuevos casos del coronavirus en Filadelfia. Actualmente tenemos un total de 16.410 casos en la ciudad y la tendencia es de disminución de los casos. Hoy no reportamos casos positivos de COVID-19 entre los internos y actualmente de 29 casos registrados, 6 internos adicionales se han recuperado satisfactoriamente. El día de ayer habíamos anunciado erróneamente 41 casos entre la población de internos. El número correcto es de 35. Y hoy, lamentablemente, reportamos 17 muertes por COVID-19 en la ciudad. Un total de 743 personas han muerto por el COVID-19. 392 o el 53% de estas muertes han sido en hogares de ancianos. Recordamos que este virus no discrimina por raza o por género. Hay 961 personas que han sido hospitalizadas en Filadelfia y 1.809 personas en la región sureste de Pensilvania. El 27% de las camas de hospitales siguen disponibles, así como también el 26% de las camas en las unidades de cuidado intensivo. Las pruebas están disponibles con previa cita. Para más información, como direcciones o números de teléfono de los centros de prueba, por favor, revisen el sitio web phila.gov/COVID-19, pestaña FAQ. Se ha expandido el criterio para administrar las pruebas. Ahora se les ofrecen a personas de todas las edades que presenten síntomas. La prioridad la tendrán los siguientes grupos que presenten síntomas del COVID-19. Personas con enfermedades crónicas o preexistentes, residentes o personas de los entornos grupales, tales como asilos de ancianos, refugios, etc. Oficiales de seguridad pública, trabajadores esenciales de supermercados, farmacias y otros comercios, y personas que hayan tenido contacto con un caso confirmado del COVID-19. Las pruebas no se recomiendan para personas que no tengan síntomas. Queremos reabrir Filadelfia lo antes posible, y la forma de hacerlo es tomando las medidas para prevenir la propagación del virus. Use la máscara cuando esté fuera de casa, porque esto es absolutamente necesario. Hay que recordar que mi máscara te protege a ti y tu máscara me protege a mí. Juntos podemos superar este gran reto. Gracias.
Thank you, Armando. We are now going to move to our Q&A portion for members of the media. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. We are asking reporters to also limit your questions to 3 or fewer. We will do a second round if time permits. So for those of you logged in today, please use the raise your hand feature, which can be found under the participants list. We also ask if you are able to please use your video to ask your questions, and we will unmute you one by one. First, we are going to go to Mitch Blocker with NBC 10. Mitch?
Thank you. Thank you. I have a couple of questions for Dr. Farley. Sir, you're still waiting on the 10,000 swabs that you ordered. I'm curious, how has that affected your ability to scale testing?
The swabs we ordered were from a company that just makes swabs. And so we are still waiting for the larger part of that order. We have found that some of the laboratories that run tests, they have an ample supply of swabs, and they will give us swabs so long as the tests go to those laboratories. And that is what has enabled us to expand testing. We're still looking for swabs from all different sources. So we're still not able to expand it as much as we want to, but we have been able to expand it, as you can see.
And what's the maximum number of people right now that could be tested in Philadelphia in a day?
Not really sure how many people want to be tested. We're testing somewhere between 1,500 and 2,000 people per day. I would like to get that ultimately at least 5,000 people per day, and perhaps as high as 10,000 people per day.
And you've talked about the importance of the mask and reopening the economy. Can you explain a little bit about how and why testing helps us open the economy?
Well, right now our case counts are fairly high, but when our case counts get very low, we want to be able to test very broadly to identify as many cases as possible that were otherwise missing. And then when we identify those cases, we will talk to those folks and do contact tracing, try to have their contacts be quarantined, and then that stops the chain of transmission. And if that doesn't work 100% of the time, but even half the time, that cuts off an awful lot of spread, and it permits other situations that we don't know to take place without getting an overall increase in cases.
Thank you, sir.
Thank you, Mitch. We are now going to go to Martin Pratt of Philly YBN.
Hi. Yes, 2 questions, both probably for Dr. Farley. One question, Dwight Evans, Congressman, mentioned that he's really pushing for mandatory testing or testing for people who don't have symptoms in the African-American community. Can you comment on why you feel that's not necessary for the city of Philadelphia?
I did speak about that before. First, we don't have enough swabs to be able to test everyone in the city. We have 1.5 million people in the city, so we simply wouldn't have enough to test everybody. And second of all, that information isn't necessarily useful, and it can actually backfire. If you were exposed to somebody yesterday and you tested today and were negative, you might actually be incubating the infection. You might become infectious tomorrow or the day after, and then you're out there exposing other people thinking that you're negative. So the information can sometimes actually work against us. So I know everybody's concerned about this. They want to be tested, but it's not always necessarily the right information. Certainly for people who are sick with this, we want them to be able to identify that so that we can notify their contacts and cut off the chains of transmission. But testing asymptomatic people, I'm not sure if we'll ever be there.
And as far as getting the Trace app or Trace to be able to do Trace contact, is the city or the health department working on any type of app or any type of solution for that?
We are building an entire program that involves people, and we're looking at different sorts of technology that will help us out. Certainly, we're going to need some technology simply to track the information, but we're also looking at these phone apps that at least have been talked about that'll assist us in identifying folks who may have been close to somebody who's a known case. We don't know if those are ever going to be useful, but we're going to look into it.
Okay. The last question is, I'm not sure if the mayor's heard about this, but today at 6:30, the city of Philadelphia has come together to decide to do doorway dancing. And Mayor, I wanted to see if we got a comment on, we talked about this about 2 weeks ago, something that the city of Philadelphia could get behind and do a viral engagement to show our love for the frontline workers and healthcare workers.
I mean, certainly anything that happens organically and that spreads or goes viral is, I hate to use the word viral, never mind. Anything that spreads and
I did. You didn't.
makes people feel, sorry about that, makes people feel better about their situation and people who are taking care of them, certainly in favor of it. And the real viral thing I would love everyone to do is to actually wear a mask. That would be something that we could do for frontline healthcare workers that would really make a difference. I really would urge everyone to find a mask that fits and is comfortable and to wear it.
Thank you. That's right.
Thanks, Martin. We are going to go to Jason Peters of Philly Weekly now.
Hello, I just need two numbers real quick. Could I have the total number of positive tests in the city prison thus far?
No, I don't have it right in front of me.
I do. I have it, Tom.
Okay.
Total positive cases in the prison since the beginning of the epidemic is 194.
Okay, and how many total people were tested?
So last week, or I guess even Friday, it was 258. So it's probably in the 260s, 270s at this point.
Okay, and when does that date range go back to?
I believe it's March 16th, but I don't know. I'll have to get back to you on the date range.
Okay, sounds good. That's all.
Yep.
Thanks, Jason. We're going to go to Kennedy Rose of the Philadelphia Business Journal.
Hi, everybody. I was just wondering, with the Work Ready program, the city was listed as one of the largest employers last year for this summer youth program, and I was wondering, will jobs still be available through the city government through this summer youth jobs program?
Brian, if you know that you can give that number, but to date, we've had 6,894 youth signed up for the program, and we aim to serve the same numbers last year at 7,000. And I know that a lot of it is private institutions and organizations and companies. I'm not sure the number in the city. You know, Brian?
I don't know.
We can get back to you.
Okay. And I was wondering, how does it feel to be one of the few cities that is still offering this summer youth jobs program despite everything that's happening with the pandemic?
We're proud of that fact. I mean, our emphasis has been on keeping, again, people healthy and safe and keeping them educated. And this is part of the education process for these young people. Even though they can't go to a physical work setting, they'll be getting a work experience that will bode well for them when this is over. And they get out of college and they could start looking for work themselves. They will remember these jobs and the people that they've interacted with that have been their mentors. And these mentorships sometimes last for years and years when the young person becomes an adult. So it makes us feel good and basic, and all the things that we're feeling stressed and bad about. These is one of the positive things that make us feel good about what we're doing.
Gotcha. Okay. And my last question, are there things that businesses should be doing now to make sure that they have the proper protocols in place when the city and the state does allow them to reopen?
Doc?
You know, I would have to think more about the specifics, but the general idea is that they're going to have to be having their employees wear masks and try to come up with situations where there's distance between people physically in their work site. And you know, we hope to be working on guidance, and in certain circumstances, there'll be regulations for specific types of businesses, but that's the kind of thing they have to be looking for.
Okay, thank you.
Thank you, Kennedy. We are going to go now to Argenis Figueroa of Univision.
Hello, good afternoon. My question will be in Spanish. Please, Armando.
Adelante, Argenis.
Gracias, Armando. Buenas tardes.
Buenas tardes.
Armando, quería preguntarle, no sé si directamente al alcalde o al doctor Farley, si han pensado en alguna recomendación para los votantes, para los votantes de la ciudad en las próximas elecciones, entendiendo que hay que guardar el distanciamiento social y el uso de la mascarilla.
My question is either for Dr. Farley or for the mayor. I'm wondering if you have any recommendation for voters in the city for the upcoming elections in terms of social distancing and wearing the masks.
Well, the doctor could talk about the medical side of it, but I mean, you have the opportunity now in Pennsylvania to vote by mail without a reason. And I would think that would be the safest way to do that and the most effective way to do it. We're still working with the city commissioners dealing with the actual physical polling places, which will have to be really reimagined as compared to what we're used to. There's places with multiple polling places in one, say, high school, for example. I mean, how do we space them out? How do people queue up safely? How do we disinfect the buttons and people are pushing the buttons in the machine? There's a lot more multifaceted issues when it comes to physical voting at a polling place than there is at the voting by mail or by absentee. So that's the issues we're dealing with right now. I don't know, Doctor, if you have any opinion.
No, nothing else to add. We think voting is extremely important and we want to make sure that it's safe, and we're developing options.
La respuesta, Argenis, es que obviamente en el lado médico sabemos cuáles son las restricciones que tenemos que observar, pero felizmente la Mancomunidad de Pensilvania está ofreciendo el voto por correo. Es más seguro que emitir las boletas en persona, es algo seguro y eficaz. Y estamos conversando con los comisionados de la ciudad para ver cómo se puede hacer en los centros de votación, porque hay que dar una reingeniería, porque hay muchas estaciones de votos en los lugares, en las escuelas secundarias, por ejemplo, y tenemos que ver cómo mantener el espacio debido, tenemos que ver cómo se pueden desinfectar los botones que hay que oprimir al momento de emitir el voto. Y por el momento lo que les recordamos es que está disponible y es recomendable votar en ausencia o votar por correo, porque es la manera más eficaz, más extremadamente cautelosa de emitir su voto, lo cual es algo muy importante. Hay que tomar la oportunidad de votar, pero hacerlo con seguridad.
Perfecto, muchas gracias, Armando. Es todo.
Por nada. Thank you.
Okay, thank you. We are going to go to Claudia Lauer of the AP.
Hey, how are you? I have kind of a complicated question, and if I need to ask it after in a follow-up, that's fine. But I was wondering if you have any way of knowing who is now the majority of the people testing positive. I know that the test demographics are changing at this point, so it might change again going into the future. But for right now, everybody's socially distancing, everybody quarantining, everybody staying at home, doing what they're supposed to do. Is there a way to figure out who is still testing positive?
Well, as far as the demographics of them, we put that on our website, and you can see their age and their race and their gender. It sounds like you're asking more complicated questions. How is it that they're still getting infected at this point? And we are trying to collect information from people who are more recent cases so we can understand how they got exposed. Right now, we're not getting a complete response to our survey, so I don't think our data is representative enough to give you an answer. But I think it's a good question. We're trying to understand that. I'm guessing it's more people in situations where they really can't social distance than it is people who are deliberately ignoring our recommendations.
So when you say it's on the website, but the website doesn't show change over time, it just shows the total as of now, correct?
That's correct. So is that what you're asking? Are the people, how are the demographics of the recent cases compared to the more earlier cases?
Yeah, and is there a way to tell if it's healthcare workers or if it's in specific communities, or I just don't know how to break it down or how the information would be available.
Let me look at it. Our information is somewhat spotty. For example, we don't know how many people have healthcare workers. We know about some of them, but we think our information is incomplete. But we can look and see if there are demographic changes over time, and there may be some, but I don't think that they're large. Well, let me look at that and see if we can get some data to you.
That would be amazing. Thank you.
Okay, thank you, Claudia. We're going to go to Laura McChrystal now of the Philadelphia Inquirer.
Hi. First, I have a question for Dr. Farley about the number of deaths. I know that yesterday there had been no new deaths reported, and that today there are 17. Were there actually none yesterday? Are some of those today already ones that were yesterday and had been delayed reporting? And also, can you just comment on whether overall are we seeing a decreasing number of deaths per day at this point?
Yeah, so you're asking a question that's really important for people to interpret the data I'm giving you. What I'm giving you each day is the number of people who have been confirmed as of the previous 24 hours as having died of the infection. Now, that's not how many people have died the previous day. They may have died days ago, or in some cases more than a couple of weeks ago. There's a variety of reasons where there may be delays between when the death occurred and when we get the report. So yesterday when I said that there were no reports of deaths, that's partly because there was not as much testing done over the weekend. And if you don't have a positive test, then you can't be a confirmed case. And so you will see that there are going to be days when the numbers are quite high and other days when the numbers are quite low. Those don't necessarily reflect how many people have been dying in the previous 24 hours. However, if you look at the graph we have on the website for deaths, you can see the cases by the date of death. And you can definitely see that there's an overall decline in that.
Okay, that makes sense. Thank you. And as far as testing, another question for Dr. Farley. As you expand the testing criteria, do you expect the number of cases reported daily to increase? And then how does that sort of affect how you're tracking how the city's doing overall and when we're ready to reopen?
So, depending on how much we increase testing, we might see just an increase in cases just because we're identifying people that we previously may not have identified. So we're also tracking the percent of tests that are positive as an overall measure of where we are. If we have a huge increase in testing, then we may have to pay more attention to the percent positive than the actual numbers. Right now, the increase in testing isn't so great that following the numbers isn't still a valid approach.
Okay. And my last question is about inmates who have been released from the prisons who tested positive. Is the city doing anything to track their outcomes after they're released? And if so, have they all recovered or have any died?
So when someone is released from the jail, they're treated like any other member of the public. We don't have a mechanism, nor would it be fair to track someone who was released from the jail under a judge's order. It just doesn't seem fair to that individual to be kind of labeled with that. Just not to be labeled. We have provided all of those individuals information on how to quarantine and take care of themselves. So we don't have any additional information on what their outcomes are at this point.
Okay, thank you. That's all from me.
Thanks, Laura. We are going to move into our second round of questions now. Wendy Saltzman with NBC 10 is up next.
This question is for Brian. Brian, can you talk to us a little bit about homelessness in the city? What is Philadelphia doing to address that issue and any specific challenges that you're facing amid the COVID crisis?
So sure. So there's a host of challenges related to COVID crisis. Certainly, we've encouraged all of our shelter operators to de-densify their shelters, which have decreased their beds. We have then added some additional beds, and so any of our winter beds that would have normally come offline in March have been maintained and are continuing to be maintained at least through the end of the fiscal year. And certainly this is a very vulnerable population. We recognize that and are doing what we can to address those vulnerabilities. Certainly not as much as many of the advocates would like us to do, and certainly I don't think any of us are happy with what resources we can provide. We're also aware of significant issues at the airport. PHL has had some challenges, and we're actively working with the airport to provide better security, but also to provide options for those individuals to go somewhere else. SEPTA is also facing significant challenges. We're working with the general manager there again to see if we can't provide better options. In the end, this is what we need is probably additional shelter space, and we're working through where the appropriate places are for additional shelter, and how we pay for that shelter long term. Because once this crisis is over, it's hard once we shelter someone to say, you know what, this crisis is over. It's time to go find something new. But these are the challenges of the region, and they're the challenges that happened. We were facing before the crisis that are just now amplified in the current times.
Do we know how many beds we normally would have this time of year versus how many we actually have now?
Yeah, so because we were able to keep our winter beds open, my understanding is that our bed count is about the same as it would normally be at this time of year. I'll go back and confirm that, and we'll also get you the specific numbers as well.
And then one last question, just about the airport. So we did go out today. We saw the people at the airport. Are they welcome to stay at the airport, or has that just kind of become a spot where they've taken shelter?
It's been a spot that they've taken shelter. This is not a long-term solution. They're not going to, we cannot have people shelter at the airport over time. It's a situation, the status quo is not acceptable, and it's one that's going to have to change. But we also want to make sure that we're providing resources for those individuals as we change that status quo. But the employees of the airport, their customers, they all have very valid concerns, and we need to address those concerns as well.
Thank you so much.
Of course.
Okay, thank you, Wendy. We're going to go back to Martin Pratt with Philly YBN. Martin?
Yes. Wanted to know, follow-up question that the Business Journal was asking about. Dr. Farley, is there any specific guidelines that you're working on specifically for co-working spaces? Philadelphia has been a city that has expanded a lot through co-working, and there are a number of co-working sites that a lot of us go to. And so is there a specific guideline you're working on for dealing with co-working spaces specifically?
We have not developed guidance like that. With your suggestion, we may consider whether that's appropriate, especially as people start to get back to work. That may be worthwhile.
Thank you. And this question is for Brian. People were contacted either by email or by the city's paging service, SMS service.
Could you repeat the question, Martin? I'm
Sure.
not sure if my connection or yours, but you broke up.
Sure. Is there a total number of people that were contacted by SMS texting and/or/email for the information updates for the month of April?
Total as of yesterday was right around 78,000. Let me see if I have a new number for you. I don't. It was right under 78,000. I will. I'll confirm that and I'll get it back to you on the exact.
Okay. Thank you. That was it.
Thanks, Martin. We are now going to Kennedy Rose at the Philadelphia Business Journal.
Hi there. This is either a question for the mayor or Brian. I was just wondering to get an update on the sort of conversations you've been having with Governor Wolf's administration about reopening and what those talks have looked like in recent days.
Well, I mean, our Chief of Staff, Jim Mangler, has been the most involved with conversations with the counties. And we've been always trying to approach this as a southeastern regional issue. That obviously we're a densely populated area of the state compared to other areas of the state. And the rules that apply, say in Erie County or in Tioga County, would not necessarily apply in Philadelphia or Montgomery County. So Jim, along with Brian, our Office of Emergency Management people, have all been interacting with, and Dr. Farley been interacting with our regional counterparts. And we articulate that information back to the governor's Chief of Staff, General Counsel, and the Pennsylvania Health Commissioner. And we've had ongoing dialogue, and I think they believe and understand that we have individual circumstances that are different from some parts of the other parts of the state. And we do have continual dialogue, and either Dr. Farley or Brian, if you want to add, please feel free. Is that what you need?
Yep, we're all good. Thank you.
Okay.
Okay, thank you, Kennedy. We're going to go to Denise Clay of the Philadelphia Sunday Sun. Denise?
Yes. Is there, once this, and I'm asking this because of an article I saw yesterday in the Detroit newspapers about a man who was trying to enforce the mask rules in his dollar store and got shot to death for it. As you hear around the country about the protests demanding that cities and states relax their rules in terms of masks and other things, has the city also, in terms of like looking at how to reopen, also addressed the criminal justice aspect of this? Will there be extra police at places where like department stores and other places to kind of, help security guards and people who don't get paid as much as the police be able to enforce the rules without getting hurt themselves?
Well, Brian can talk about personnel, but let me just talk about the general issue that we find ourselves in. First of all, there's too many guns in our society. There's too many people carrying guns. Too many people have guns. You've seen the president, sadly, send mixed signals and misinformation around the country by tweet and by press conference, telling people to resist governments, cities that are trying to impose safety measures to keep people safe and alive. And he's tweeted things like free Michigan and free Minnesota and free all this other stuff. So that's sending out this kind of ugly message where people now in open carry states are dressing up like soldiers with their face covered with so all of this is the environment that we're in. So, and my heart goes out to the family of that security guard who was simply doing his job when some guy felt, not number one, he didn't need a mask, and number two, he could kill somebody as a result of it. We will staff as best we can. I don't think we have, and Brian, you can jump in, we have the personnel to put an officer in every retail spot in the city, but we just have to understand that we are in a different environment and it's a different world, and we have to help each other as opposed to hurt each other and, God forbid, kill each other. Right?
Yeah. So we don't have the number of police officers to be extra security guards for any establishments. I think we'll be asking people to use their common sense when enforcing these rules, and certainly. If a security guard or a staff member encounters someone that refuses to put on a mask, I'd also ask them to use common sense about how strong of a confrontation they should get into. Our police officers will certainly respond, but I also want to, there's a balance here between the disparate impact of us trying to enforce rules and what does that enforcement look like? I don't want my cops to put anybody in handcuffs because they didn't wear a mask. And if they did, they'd make it all over all of your front pages and on your cameras. So we're going to try and figure out how to balance that. We're going to continue to work with our retail establishments, but a law enforcement should be the last road or last avenue for enforcement on this.
And hope for our better angels.
Okay. I have another question. This one regards the budget. Is there a plan B that you have in case council decides not to pass the with the property tax increases in it?
If there's any changes to the budget that's made by council has the responsibility to show where the money is going to come from to pay for schools or anything else that might be cut. So, we have a responsibility to put a budget together, which we did for February, and then we had to obviously adjust it because of this catastrophic situation. And we believe, and I believe personally, that education and keeping our school moving forward is one of the most important things we can do going forward in our city. This too, at some point, will pass, but we still have to make sure that our kids are educated so they can be a good pool of employees for potential employers. And I refuse to go backwards to 2008 and 2009 when everything got cut. Our kids got suffered as a result of it. They lost ground in their education. They lost ground in getting their needs taken care of. And if I don't think the council will do that, but if they choose that they want to not pass our budget and want to change things, then they need to have the responsibility, and I hope they do, and believe that they do, to have responsibility to show where the money's coming from. The same thing goes with any other elected officials who are critical of our budget approach. If you have better ideas, then try to let us know what they are and see if they can be implemented. But don't just wave your hand away and say, well, we're not going to do this and not expect circumstances to be bad.
Okay, thank you.
Thank you, Denise. We're going to go to Brian McCrone with NBC 10 Digital.
Thanks a lot. Good afternoon, everyone. Does the city have a position on separating nursing home cases and deaths from the overall totals?
What do you mean by separating?
Two separate tallies. Yeah.
We look at those numbers. Are you mean as far as criteria for opening the region?
Well, I mean that could be one aspect of it, certainly. But yeah, I mean, I think that would definitely probably be the main thrust. There's been some discussion in the suburbs, the Delco County Council and some Bucks officials. Yeah.
Well, let me first say that we follow a variety of different statistics beyond the things that I talk about here every day, including the number of cases in nursing homes, the number of deaths in nursing homes, which I do report every day. Nursing homes are extremely important. That's where more than half of our deaths are occurring. So I would strongly disagree with anybody who says we should discount them. But if people want to count them separately in any decision making, I think that that's fine, as long as it's clear that they are important.
Okay. The city hasn't had. Have you talked to Governor Wolf's administration about it at all?
Yeah, we're talking to Governor Wolf's administration on the issue of reopening and nursing homes all the time. But right now we're still under the governor's reopening plan as he's stated it, which doesn't distinguish cases in the community from cases in the nursing home.
Okay. And can I ask you a broader question too, as this has come up over the last few days and as it's just continued to rise, but we knew this from early on with nursing homes. Why the approach by the healthcare system, in your opinion, not to take some or any or all nursing home residents who have contracted the disease out of nursing homes and into the broader healthcare system?
Well, nursing home people are very frail. And if you simply move them to another place, that's like taking them away from their home. Many of them have early dementia, and that can throw them up quite a bit. There is a mortality rate simply from moving people from nursing homes to another facility. What you want to do is make it so that the people who don't have the infection don't receive the infection from people who do. And so that's what we're doing in nursing homes. We try to identify cases and then do what we call cohorting. You have the positives in one place, negatives in the other. That's a much safer approach than trying to remove the people with infection from the facility.
All right. Thank you very much.
Thank you, Brian. We're going to go to Hannah Chin now with WHYY.
Great, thank you so much. So I just wanted to quickly ask, I know the number of new deaths was 17. I was wondering if you could give us the number of total deaths reported so far in the city. The number I have is 743. I was wondering if that's correct.
It is 743, correct.
Great, thank you. And then I just wanted to follow up on a question that was asked earlier about reopening. I know you mentioned that Philadelphia has a different case than other counties because it's more densely populated, et cetera. I was wondering if there's any additional precautions that you're taking kind of beyond state guidelines before encouraging city businesses to reopen.
But I would simply say that, first, the governor's plan has a couple stages of reopening, and they're going from red to yellow, yellow to green. Different levels, different businesses are allowed to open. At any stage where there's certain businesses that are allowed to open, we're going to want to work with them to put in place safe practices so that they don't spread the infection in that business.
Great, thank you.
Thank you, Hannah. We are going to go to Martin Pratt of Philly YBN.
Yes, Dr. Farley, the nursing home, do we have statistics anywhere on the website or in general about specific COVID deaths at nursing homes by themselves?
I'm not sure I understand the question. So every day I report the number of deaths among people who are nursing home residents. What else were you asking for beyond that?
That was it. I was looking for that at the website. I couldn't find it. That's what I was.
I'm not sure if it's on our website, but I am reporting it every day in these sessions. And we can get that to you if you want. Yeah.
Okay, I'll send an email. Thank you.
And Martin, it's 77,990 people have registered for the text alerts.
Thank you, Brian.
Yep.
Okay, seeing no further questions, that will conclude our briefing and we will be back tomorrow at 1 p.m. Thank you.